Welcome to the Central Maine Medical Center's Cynthia A. Ride-Home Cancer Treatment Center. We administer radiation therapy, an effective method of treatment for many types of cancer. Radiation is one of the several types of cancer treatments a patient may receive from our Central Maine Comprehensive Cancer Center. For instance, your treatment may also include surgery or chemotherapy. With ready access to high-tech equipment, leading-edge research, and a multidisciplinary team of specialists, this comprehensive approach can have a powerful impact on a patient's well-being. Patients may also take charge of their own treatment by understanding goals of treatment, what to expect during treatment, and how to work with their doctors to follow their treatment plan. These video modules present information on how radiation treatment works and what you can expect before, during, and after radiation treatment at Central Maine Medical Center. Radiation is an effective treatment to control many types of cancer. It is also used to help relieve symptoms caused by cancer, such as pain, bleeding, and shortness of breath. In external beam radiation, radiation is directed from outside the body to kill cancer cells. Unlike chemotherapy, in which a chemical affects all cells in the body, radiation is a way to directly target cancer cells in specific locations of the body with only minimum damage to healthy cells. If you have been referred for a radiation oncology consult, you will first meet with one of our radiation oncology nurses. The RN will review your history, medications, and provide general radiation education. You will then meet with one of our radiation oncologists to discuss the potential benefits and the risks of radiation therapy. This is also one of the many opportunities to ask questions.
As one of your physicians here at Central Maine Medical Center, I'll be involved in developing an independent, individualized plan in your cancer care. First step or first meeting with the physician will be a consultation where we'll discuss your diagnosis in great detail. We'll give you written information about the plan that we'd like to proceed in recommending treatment for your care, as well as the associated side effects that will include all risks and benefits in our approach to treating your cancer.
To be effective, radiation therapy must be aimed exactly at the same area of the body each and every time treatment is given. The process of measuring the body and marking your skin to help your team direct the beams of radiation safely and exactly to their intended locations is called simulation. During simulation, your radiation oncologist and radiation therapist place you on a CT simulator machine in the exact position you will be in during the actual treatment. They will use immobilization devices such as molds, casts, headrests, or other objects to help you stay in exactly the same position during the entire treatment. The radiation therapist marks the immobilization devices and tattoos your skin so they can always find the exact spot on your body to be treated. Once you have finished with your simulation, the members of your treatment team, including your doctor, physicist, and dosimetrist, review the information they obtain to develop a treatment plan.
When we individualize your treatment plans, we will take into account the specific anatomy with both your cancer and the normal structures surrounding your cancer, so that each patient's treatment plan is totally different from any other patient, even with the same diagnosis of cancer.
After reviewing all of this information, your doctor will write a prescription that outlines exactly how much radiation you will receive and to what parts of your body. When you undergo external beam radiation therapy treatment, each session is painless, just like getting an X-ray. Time spent in the treatment room may vary depending on the treatment plan created specifically for you, but it generally ranges from 10 to 30 minutes. Treatments are usually scheduled 5 days a week, Monday through Friday, and continue for 1 to 7 weeks, again depending on your plan and how it works. If an immobilization device was made during simulation, it will be used during every treatment to make sure you are in the exact same position every day. The lights are turned off as you are positioned correctly. Then the therapist will leave the room and go out to the control area to closely monitor you on a television screen while delivering the radiation.
How you doing, Nicole?
My nose itches. Can I scratch it?
No, we just want you to hold real still. This will only take a couple of minutes.
There is a microphone in the treatment room, so you can always talk with the therapist if you have any concerns. The machine can be stopped at any time.
When you come for your treatments, you will see the physician at least once weekly. At that meeting, we will discuss any side effects that you have and make recommendations as to how to deal with those side effects, whether it be prescription medication or over-the-counter medication. In addition, there are other members of the team you can consult with during that week. That would include nurses and therapy staff. If you have any other concerns or questions, they would bring that up to the physician in order to coordinate your best care.
Depending on your treatment, radiation may produce side effects. For instance, you may notice some tiredness or perhaps some skin changes like a sunburn or a suntan. It's crucial that you discuss with your doctor or nurse if you are having any side effects, because most side effects can be taken care of with appropriate medication.
One of the misconceptions about radiation is that people are radioactive. In effect, once you leave the department, you are not radioactive. The radiation is directed at your cancer. It's specific and focused. We ask that you keep a normal life as much as possible. If you choose to work, drive your own car, there's nothing special that you have to do because you're having radiation. There's nothing that you can't do because you're having radiation. One of the ways you can help yourself during treatment is to keep an active lifestyle as much as possible, get as much rest during your normal restful hours, and eat as good a nutritional and balanced diet as possible. In addition, if you're having any problems during your treatment, we ask that you bring those problems up to the nursing staff or the therapist who are taking care of you, so we can take care of your problems sooner rather than later.
For the support of patients and loved ones during treatment, our oncology social workers offer a wide variety of services. They can help with practical issues, emotional concerns, and offer needed referrals. Practical issues that the social worker can help with include assisting with advanced directives or help with finding additional resources. These might include transportation, support groups, hospice and wellness, and survivorship programs. During treatments or hospital stays, accommodations for patients or family can be set up at the Arbor House, free housing just across the street from the Radiation Oncology Department. Our financial counselor can assist with work and disability questions, insurance coverage issues, and help patients maximize the benefits they might be eligible to receive. The Patrick Dempsey Center for Cancer Hope and Healing is a cancer resource center right here at CMMC. It's designed to offer support, education, and wellness services to those diagnosed with cancer, as well as their caregivers. All services are provided free of charge. In a warm, inviting environment, patients can discuss their needs and make use of a cancer resource library. The Dempsey Center offers such services as transportation assistance, social support, and education groups, integrative medicine workshops, and treatments such as massage, Reiki, acupuncture, and yoga. After the treatment is completed, follow-up appointments will be scheduled so that your radiation oncologist can make sure your recovery is proceeding as expected. Your doctor, in concert with other members of your team, may also order additional diagnostic tests. As time goes by, the number of times you will need to visit your radiation oncologist will decrease. However, you should know that your radiation oncology team will always be available should you have questions about your treatment.
Once treatments are complete, radiation continues to work. If you have any concerns about your care, your cancer, and wish to discuss those with us, please don't hesitate to give the office a call, as we'd be happy to see you at any time.
Patients feel good when they take an active part in carrying out their treatment, and when they leave here, they know the treatment will still be doing its work. The Cynthia A. Ride Home Cancer Treatment Center at Central Maine Medical Center.